Pull up a chair and dig into Oklahoma's official state meal, served up by the legislature in 1988 as a way to boast of our local specialties. Corn, squash, black-eyed peas, and strawberries are on that menu.
But so are chicken fried steak, biscuits and gravy, barbecue pork, cornbread, fried okra, and pecan pie. Meals that come with consequences.
Symptomatic of why thousands of our family and friends are dying prematurely of broken hearts.
And part of what's keeping Oklahoma from becoming so much more. Something they're trying to turn around at the University of Oklahoma's Wayman Tisdale Specialty Medical Clinic here in Tulsa. Dr. Mark Fox has a life to save today.
Hello.
Daryl Williams' life.
I might stay up till about 3.
Daryl's fighting a battle familiar to so many. At 54, life's taken a toll.
It's rough. I'll put on my big boy pants, but man, it's pretty rough.
Blood pressure's up a little bit.
His mother died a couple of years ago. His wife's sick and he's her caregiver. He's dangerously overweight, battling high cholesterol, hypertension, no health insurance. He's barreling towards a heart attack or stroke.
I'm dealing with quite a few things, you know, that really threw me, and trying to maintain my health and trying to stay upbeat about it.
Daryl is a living, breathing embodiment of Oklahoma's abysmal health rankings. Trying to counter that with his heart improvement program here at the University of Oklahoma's Wayman Tisdale Specialty Clinic. It's Dr. Fox's goal to keep Daryl and hundreds of others living and breathing.
So this area in North Tulsa has the highest rates of cardiovascular disease in a state that's among the worst in terms of cardiovascular disease. So I always describe North Tulsa as ground zero for cardiovascular risk.
In 2008, OU School of Public Health released some startling research. It said that although residents of North, East, and West Tulsa made up 40% of the city's population, they had access to only 4% of the city's physicians, and that they lived on average 14 fewer years than residents of Midtown and South Tulsa.
That put things in stark terms that people could understand.
So the university's Tulsa School of Community Medicine teamed with the city's philanthropies and opened the Tisdale Clinic 2 years ago.
We said this is a moral imperative. This is not right. We've got to make sure that it shouldn't matter what your zip code is, how long you're expected to live.
The Tisdale Clinic's mission is to throw out the old playbook and deliver health care in new and novel ways.
Efforts to improve health literacy, to address poverty, to address violence, teen pregnancy, smoking, all those things have an impact on the health of the community.
The challenges of patient care here go far beyond the prescription pad.
I can give all the right answers out here in North Tulsa and say, you need more fresh fruit and produce. And good luck getting it at, you know, at the stores where you might buy food out here. You know, Dollar General doesn't have fresh fruit and produce.
What North Tulsa does have now are the 17 specialties offered at Tisdale, because specialty medical care was completely absent in this part of town before. And 3 of those specialties are exclusive to all of northeastern Oklahoma.
It was a blessing that when I went to St. John's emergency room.
Because like so many of the uninsured, an emergency room was where Daryl went for relief from his intense chest pain. At St. John, they suggested he become a patient at Tisdale.
Man, it's a lifesaver.
So our goal is to identify people in this community with increased risk, but especially those that have barriers to care, and the biggest barrier is lack of insurance.
Tisdale patients are charged on a sliding scale if they're not covered by insurance or Medicare or Medicaid. Daryl has become an advocate among his friends and neighbors.
When you see the people that you grew up with, and you know, he's paralyzed on one side, this one's in a walker, you know, they pack an oxygen tank. I mean, that's pretty humbling.
Dr. Fox says the early signs are encouraging. Things won't turn around overnight, but in a state with so much more to do to improve its health, each time someone makes the commitment, we are one step closer.
And certainly in our outcomes in the Heart Improvement Project, we've seen dramatic improvements in blood pressure control, diabetes control, cholesterol control.
Hang in there.
Which, again, we hope will translate into a reduction in heart attacks and strokes over time.
Well, that day we were with him, Daryl had already lost 50 pounds, so he's on his way. The Tisdale Clinic is always accepting new patients. They're on East 36th Street North, and the link to them is inside this story, newson6.com. Let me know what you're doing to make Oklahoma so much more with an email to so much more at newson6.net.